What does scoliosis mean? The term scoliosis was first coined by Hippocrates. Simply put, the term scoliosis means bent spine. Scoliosis involves the development of an unnatural sideways curvature, and the scoliosis curvature typically has a twist or a rotation associated with it, and making scoliosis a true three-dimensional condition. The twist or the rotation is into the concavity of the scoliosis, most likely. To be considered a true scoliosis, the scoliosis curvature must have a Cobb angle measurement of 10 degrees or greater. This Cobb angle is measured through a scoliosis X-ray, and it helps us determine the severity or the size of the scoliosis. The size of the scoliosis is related to how high the Cobb angle is, meaning the higher the Cobb angle, the more severe the scoliosis, the lower the Cobb angle, the more mild the scoliosis. The Cobb angle is measured by measuring the most tilted vertebra at the top end of the curve to the most tilted vertebra in the bottom end of the curve, and drawing intersecting lines and measuring this angle in degrees. This classifies us as a mild, moderate, severe, or very severe scoliosis. Now, when we look at scoliosis, we know there are many different types of scoliosis, and the types of scoliosis help us determine what type of treatment the person will need, and this normally the type is determined by the underlying cause. Now, the most common type of scoliosis that's diagnosed is something called idiopathic scoliosis. Now, idiopathic scoliosis means that there's no clearly associated single cause associated with the scoliosis. So the majority of cases of scoliosis have unknown causation. This is 80% or so of all diagnosed cases of scoliosis are diagnosed as idiopathic. This is by far the most prevalent type, and it's most often diagnosed in adolescent cases during 10 and 18 years of age when they go through growth spurts, because during growth is when we see curve progression. Now, there are other types of scoliosis cases. Even though we know idiopathic is definitely 80% of the cases out there, the remaining 20% of scoliosis are associated with known causes, one being neuromuscular scoliosis, second being degenerative scoliosis, and the last type is something called congenital scoliosis. Neuromuscular scoliosis is caused when there's a presence of a larger neuromuscular condition causing a disconnection between the connective tissue and the nerve system of the body. These are normally broken down into three different types of categories. Something causing muscle contractures, like cerebral palsy, could be associated with the causation of scoliosis. Something causing ligament laxity or tissue laxity, like Ehlers-Danlos syndrome or Marfan syndrome, which could be associated with the causation of scoliosis. And then something that affects the nerve system, something like a syrinx or some type of Arnold-Chiari syndrome that can cause some kind of neurological disturbance, which could be associated with the development of scoliosis. Degenerative scoliosis, it causes when something shifts the spine in young adult life, causes one area of the spine to shift in relation to the bone above and below. This remains out of alignment and causes abnormal or accelerated degeneration in this area. And this abnormal degeneration leads to a degenerative scoliosis occurring, most commonly occurring in the lumbar spine and most commonly diagnosed at 50 plus years of age in women. The last type is congenital scoliosis, which is a rare form of scoliosis, but it typically occurs in utero. We think less than 5% of cases are congenital, and it's a result of having a malformed bone developing in utero, and the patient is born with scoliosis. And this malformed bone is called a hemivertebra, most likely, and it's where the bone is shaped more like a triangle than a rectangle, and it will cause a scoliosis. Congenital scoliosis is the easiest to diagnose because we can easily see that on the X-ray, seeing a mal-shaped bone. Now, being diagnosed with scoliosis means that there is an unnatural spinal waves curvature that also rotates, and it's beginning to develop. Now, when a scoliosis is being diagnosed, and doesn't necessarily mean where it's going to stay, we know scoliosis is a progressive condition. It is in its very nature to worsen over time. Now, we know the most common time that curves progress is during rapid growth. So no matter what type, whether it be idiopathic scoliosis, neuromuscular scoliosis, or congenital scoliosis, we know during growth phases is where curves can progress from mild to moderate severe and very severe, meaning curves can change. They can start off with mild, and as they grow, they can become moderate and become severe and very severe. And normally it happens during growth. So during this time, or during puberty, or during growth phases, when curves have to be very, very closely monitored for progression. However, in the adult stage, curves still progress. Now, they progress for one, two main factors that cause progression. First thing is size of curve. The bigger the curve is in the adult form, the faster gravity will affect it. Where the smaller the curve, the less gravity will affect it. So we think the average 50-degree curve progresses about 1 degree a year for a year of life, and this progression will accelerate as patients become older. So age and size of curve, as these two things increase, curve progression gets faster. So in the adult patient, curve progression tends to occur because it tends to snowball. So they can start off very linear. So let's say it's a 50-degree curve progressing 1 degree a year. When they hit around 40 to 50 years of age, they can start going 2 degrees a year. When they hit about 55 to 60, it can start going maybe 4 degrees a year, and they start increasing the rate of progression as the curve becomes bigger and it becomes older. Most kids feel no pain as a result of scoliosis. Unfortunately, most adults feel pain with scoliosis as their curve progresses. We know scoliosis is progressive. We know it's uncurable in the majority of cases. We can't tell you what's causing it, so we can't cure it. We know it's progressive, but we can definitely treat it. Despite whatever the causation, the majority of scoliosis cases can be treated, and they definitely can be treated when they're treated early to its detection, meaning when you detect it early and you treat it earlier. We know conservative treatment plans have much greater effectiveness, and there's much less limitations to what can be achieved. Even though the average patient I treat is already a severe scoliosis that are facing the diagnosis or facing the surgical recommendation, I would much rather treat curves when they're much smaller, because we know smaller curves respond better, we can have a better impact. The goal of treating a scoliosis is that you must treat it structurally. You can't just treat the symptoms associated with scoliosis. Sometimes patients can have some functional symptoms and can have some pain, and they think that the pain is the problem, and they take medications or do some injections to make themselves feel better, but their curve is still progressing. The best way to treat scoliosis is to proactively reduce the scoliosis before it worsens, but if it's already worsened, then the goal is to reduce the structure, because as the curve gets bigger, it's more likely to get bigger. So curve or structural reduction is by far the best approach.
Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.